Hello, everybody. Welcome to the International Nurses Day 2015 live program. My name is Felicity Kelliher, and I'm going to be with you for the next 15 minutes, commenting the results of the survey on how nurses are perceived in the world. And also I'll be answering your questions that you can send via the site. Just make sure you put them in the box on the right-hand side of the page. And I can also answer questions that you send by Twitter using the hashtag IND2015. Just a few words about myself. I'm a nurse. I trained in Ireland, and then I trained as a midwife after that. I've been living in France for the last 30 years, working first of all as a nurse. Then I worked as a clinical manager. And in the last 15 years, I've been a nurse teacher. Actually, I'm working in the AFDET, which is the French association that promotes patient education. And I design training programs, and I train multidisciplinary teams in patient education focused on patients. So we've actually started to receive a couple of questions. I have one that's just come up on my screen. It's from Twitter. And the question is about the survey. This is a survey that has been commissioned by Sanofi, by the Reputation Institute. And it is a survey that is how nurses are perceived. So the question is, why is this survey a great initiative? And what does it tell us about how nurses are perceived around the world? Well, now, this survey is an absolutely fantastic initiative because it's probably the first time that we have a survey that is so global. Now, global in that it is not all the countries of the world, but 13 countries are included in this survey. Over 1,000 people have answered the questions, and it is really interesting to be able to measure the perception that people have of nurses. Now, obviously nurses are first of all perceived as professionals that are caring, helpful, kind, but at the same time we see results coming that nurses are knowledgeable, nurses are intelligent, nurses are competent. The survey is also letting us know how people perceive what nurses actually do. Now, obviously high up in the results are things, hospital and institution type care. Nurses are perceived as people that work in hospitals, that do technical procedures, and that take care of people that have intricate operations or need specific care. At the same time, people perceive nurses as people as professionals that vaccinate. It's one of the main moments when people actually meet up with nurses. Also coming out in the survey is that nurses are educators. They educate patients, or rather people, first of all, in preventing disease, and they educate people that have already got different illnesses, mainly chronic diseases. The other interesting thing that has come out of this survey is that people were asked to tell us what they feel nurses should do in the future, on what type of things they should spend more time. And what's coming out of this is very interesting. Even though nurses will be continuing to work in hospital-based care, they are also perceived as people that must give more time to educating patients, to enabling patients to self-manage, as we know that there is going to be a greater burden of chronic disease as the years go on. People are living longer, they're developing 1, 2 or more chronic diseases, and the public health issue is that they manage these diseases, and nurses are perceived as being in the forefront of helping people to do this. They're also perceived as being in the forefront on prevention in general, and they're perceived very much as vaccinators. We've just seen another question coming in now. The question via the site is, in your opinion, what are the most promising results in the survey? Yes, indeed, there are very many interesting results in the survey. My first answer to that would be that nurses are really very trusted professionals. For example, well, I'm in France, and what has come forward for the French perception in France is that 90.7% of the French people that answered, they have an excellent image of nurses. This is very important, and it's actually similar in other countries. It's similar in the UK, it's similar in Australia. I think Australia has 91.6% of the people that answered that said they have an excellent image of nurses. I think this is a very important result for the nursing profession, to know that we are trusted professionals, trusted by people, trusted by patients. The next thing that I would say came out of this survey is that nurses are absolutely in the center of the care for people that have chronic conditions. Nurses are also central for the elderly. The elderly responders have given a very high opinion of nurses. This obviously is going to have an interesting follow-up for the place that nurses have in helping patients to self-manage. Talking about self-management, it seems that the people that answered would be very interested in having nurses helping with patient empowerment. How, as we move forward, can nurses contribute to patients finding out answers that suit their situation, how they can tailor care for each individual patient who's living their life in their country, in their situation, and nurses seem to be the people that are going to be able to provide the support to the patients. So the other aspect that has come out is that nurses are not only vital for education of people with chronic conditions, but they're also very necessary as regards preventing diseases through education and through vaccination. And the other big result is that nurses worldwide seem to have shown that they have a vital role in improving health and improving quality of life for people through better health outcomes. So it means that there's probably scope for working on how they're perceived both in developed and emerging countries, which give patterns that are not quite the same. Okay, I think there's another question just coming in now. It's about the global reputation score of nurses. This survey actually was based on really a sort of score system which shows a traffic light system from very, very green through orange to red. And so we have this global reputation score, and how could it be increased, or how could it be increased? Now, when I looked at the scores, I saw that there are different levels of reputation with a certain amount of variations. I have them here, and you'll be able to look at them on the report. In Europe and North America, nurses have a very high reputation score. It varies then through Mexico, Turkey, China, and going lowest in South Africa. We're not quite sure why, but nurses have a score of 56.4 people who have a very positive opinion, compared with, say, the UK, where it's 91.4. Again, the reputation score, when we look at the people that are interested or who give a good score to nurses, we find that the elderly people, the older people, give the highest score, whereas younger generations give, it varies from country to country, but they give a lower score to nurses. Now, this could be interesting to see in the light of, well, elderly people are more likely to be cared for by nurses, whether it is in their homes or whether it is in institutional care, because they have developed problems, whether it's a lack of autonomy or whether it's due to different chronic diseases. Younger people are less likely to meet up with nurses because they're in better health. However, the other question we can ask is, are younger people changing because they're going to be more likely to self-manage their different conditions, self-manage their own prevention, because these are people who are obviously connected and have access to information. So there may be some scope there for nurses to change, we'll see. And then another thing about the global reputation score of nurses is that in the question, would you be likely to recommend a nurse, or how likely would you be to recommend a nurse? Some countries give a lower level of recommendation. They say, for example, in China, less people would be likely to recommend a nurse. And this is very strange because these are the same people that would be very likely to follow a nurse's advice. Whereas in other countries, well, Europe and North America, nurses are, patients would be less likely to recommend a nurse, more likely to recommend a nurse and less likely to follow their advice. So there's something interesting to be looked at here. Another thing that we can do about the reputation score is look at the nurse population ratio. As you know, worldwide, we measure that per 1,000. How many nurses are there per 1,000 population? And when we look at countries in Europe, well, for example, Denmark at 16.1 nurses per 1,000 population. Ireland is probably around 13 at the moment. France is 9.1 nurses per 1,000 population. And then a country that has a very low or gives a lower reputation to nurses, like South Africa, has only 1.1 nurse per 1,000 population. So it may be that people give a lower reputation to nurses because they're less likely to meet a nurse because there are just fewer nurses in the country. But we're still getting questions. This is a question about Europe. This is coming by Twitter. Now, we have a question of how can European countries keep increasing nurses' consideration and reputation? As I said, there's a reasonably high level of reputation for nurses in Europe, 90.7 in France, 91.4 in the UK. Spain is at 74.2, which these are all in the green area. Now, what we have to know about Europe is that generally now today, nurses are educated to bachelor level. We have been very fortunate to have got our act together since 1977 with the European Union, and nurses have decided together that they should have bachelor level education. In Europe as well, we have the development of advanced practitioners who are educated to master level in nursing science or other sciences, and they contribute to making nurses interact with the population at different levels, and especially in primary care. How can we increase their consideration and reputation? It's probably, first of all, through the service that nurses are giving to patients. As we saw, their profiles are changing. People are living longer, they're living with chronic diseases. All these people can no longer be cared for in hospitals. It's not even desirable for the patients themselves. It's not desirable, obviously, from an economic point of view. So therefore, care is going to be taking place at a primary level, where people will be in contact with professionals close to their own home or in their own home. So nurses have to get in there. They have to work with government to say, okay, we're going to make nurses available to the public. We all know that nurses do cost less. We take 3 to 5 years to train, and it's a cost-effective way of helping patients to manage their conditions. Obviously, it's a cost-effective way of doing prevention because nurses can vaccinate, and people need vaccinations, so nurses should be allowed to vaccinate autonomously. Apart from primary care and role development, we also need nurses to be able to do patient education in a way that's incorporated into day-to-day care. In the last 10 years, we have seen throughout Europe the development of patient education programs. Now, while these do give effective results on the short term, patient education programs such as, for example, the Desmond program in the UK for diabetes patients, after a few years, the results are not so good because patients' lives are complex and they are dealing with complex problems. One of the answers to this is for nurses to be able to provide education ongoing, because when a patient has a problem, it's better that they find an answer to that problem straight away rather than having to wait a number of weeks before they get re-enrolled into an education program. So it's very clear that nurses who are trained to do this should be allowed to educate as they are taking care of people. Now, also in Europe, one of the big issues is nursing leadership, and nursing leadership not only in institutions such as hospitals, but also in care authorities. I know, for example, in France, we have a big problem with that, and we have a problem with the Council of Nurses that is a little bit fragile at the moment. But throughout Europe, we need to be able to see that nurses are a voice to be reckoned with, and that their opinion should be asked before making political decisions about care and care allocation. So that's about Europe. Well, we have another question here, which is interesting because it's a question about next steps. It's come in on the site. What are the next steps towards empowering nurses? Now, this is an interesting question because obviously worldwide, while we see that nurses have an excellent reputation, some patients or some people who've answered have said that nurses are stressed and busy and not necessarily available because they've got too much to do. So possibly the first thing is, as I said, if nurses can be allowed to make decisions about staffing levels, we're going to be able to find nurses able to answer patients' needs. So for nurses' empowerment, again, we need to have nurses making the choices about staffing levels. This has been a big issue in Europe, but worldwide in the last number of years. Who decides on staffing levels? Is it to be decided at statutory level, at a government level, or should nurses be directly involved using their clinical decision-making to say, this amount, this patient, these patients, with their care needs such and such an amount of nurses. We know how to do this. We've known how to do this for the last 25 years, and it needs to be recognized by government and local care authorities. So this would definitely be a step towards nurse empowerment. Now, another area where nurses are going to be able to be empowered is involving them in the rolling out of e-health tools. Now, I won't go any more into e-health because this afternoon a colleague, Nick Hardiker, will be developing this subject, so you can listen in at 1400 hours French time. But we just need to make sure that nurses are associated not just with their use but with their development. The other area I think that nurses could be empowered is perhaps rather than being just the advice givers, because this seems to be a situation where we find in certain countries where people follow, should we say almost blindly, the nurse's advice, is that nurses themselves be educated and empowered to help patients move towards self-management. The older people can be helped with shared decision-making, and nurses need to be trained in order to facilitate decision-making with patients, and nurses need to be trained to facilitate empowerment of patients. This will also mean that nurses will probably be empowered and prepared to help the younger generations that are moving on, and for the moment they don't trust nurses as much as older patients. So it may well be that if nurses can embrace self-management, aid for patients, empowerment for patients, the support in using IT, we will see nurse empowerment because they're going to be present. Okay, well, it looks as if we're really coming to the end of our time now. I don't see any more questions coming in for the moment. Please don't hesitate to continue sending your questions because we're going to be able to provide answers during the day. Well, look, I was really delighted to be on this platform today for International Nurses Day. It's not over the day, so please check in on the site to see the program, which is continuing, moving westwards. We'll be going via UK up to Mexico. And just keep tuned and look, fair play to all the nurses. Thank you very much.